Cervical kyphosis, the hidden car crash injury most doctors miss, and you can fix it without surgery. You might be thinking that when you walked away from a car accident, you don't have a scratch, but what if I told you the real injury isn't even showing up yet? Most doctors miss one of the most common hidden injuries from a crash. It's called cervical kyphosis. Remember, ligaments hold you in alignment, and just in case it doesn't cause neck pain, it can lead to arm numbness. So sometimes you might not have neck pain per se, but you might have upper back pain. You could have headaches. You could have numbness or pins and needles in your arm. And you could have horrible headaches, horrible migraines, and sometimes long-term spinal damage. And the reality is, like most health problems, if you don't fix it, it only gets worse. But no one tells you this. You don't need surgery. You don't need drugs or endless treatment to correct it. In this video, I'm going to show you how to properly diagnose and how to fix cervical kyphosis, one of the most common problems after a whiplash accident. And I'm going to show you proven, research-backed method called Chiropractic BioPhysics. And if you like to look up the research, just look up CBP nonprofit. There's tons of research and videos for those of you that really want to geek out in research. Otherwise, you're going to have to take my word for it. By the end, you're going to know exactly how to spot and treat this injury before it's too late. You're also going to have basic knowledges so that when you go into a practitioner's office, you're going to kind of know, do they know what they're talking about? Now, I'm Dr. Gregory Kramer. I have over 33 years of clinical experience and advanced certification in chiropractic biophysics, which is structural rehab. I specialize in treating chronic health problems like chronic whiplash, chronic disc herniations or L4, L5 disc bulge, chronic sciatica, chronic knee problems, chronic neuropathy or peripheral neuropathy, and a variety of other degenerative spinal conditions. I use a variety of corrective methods. I use mirror image adjustments, mirror image exercise, mirror image corrective traction, and spinal decompression to compress discs and nerves. So before we continue with this video, if you think you're going to like what I have to offer, if you find this information that I've been putting out there interesting, do me a favor, hit the subscribe button. If you want to learn how to eliminate pain, avoid surgery, stabilize your spine so you can live stronger longer. Now, you know, it's funny. Today, or in fact this week, over the last few videos, I started talking about whiplash, okay? And again, if you want to go to the initial video, you can see what I talked about. It's where the head goes forward and back very fast. Now, you can have a fall, but it's most common when you get rear-ended in a car accident. But it can happen in a variety of ways. I had a number of patients call me up today because they saw these videos. And the same story happens, is that whiplash gets poorly managed. And we're going to talk about that. It's not just a sore neck, all right? It's much more than that. It's an acceleration, deceleration injury that can seriously damage your neck or cervical spine. So when a car crash happens, especially a rear end, your head whips forward and back in milliseconds. Now the force isn't natural for your spine, and instead of moving like it should, your neck experiences something called a snap-through buckling, where temporarily it bends in an S shape instead of a normal curve. Now your neck's supposed to have a normal C curve, kind of like a banana. Now this is called a lordosis, and this is crucial. Your neck curve absorbs shock, it eliminates pressure on the spinal cord, and it's very important to distribute the weight properly and also protect the small little nerves that go down your arms. But when a whiplash forces your spine into a kyphotic position or a reverse curve, things go wrong. In fact, many researchers, when they look at how we quantify or grade a whiplash injury, one of the serious indicators of an injury is if there's a kyphosis in your neck. That means you've injured the ligaments so severe your neck's literally on backwards. So a kyphosis is a structural deformity. It's not just bad posture. It physically changes how your spine functions. Over time, this is going to lead to neck pain, chronic muscle tension. That leads to fatigue. If your muscles have to work harder, your body's inefficient. Obviously, headaches, migraines. You can have arm pain, numbness, pins and needles, even long-term spinal degeneration. Now remember, we've talked about this in the past, is that degeneration, whether it's your car tire, a building, or your spine, deals with force plus time. When you're out of alignment, just like your tires, if they're out of alignment, There's more friction, there's more force on the tires, therefore they wear out faster. The human body is no different. The trouble is, replacing your spine is much harder than replacing your tires. In fact, we can't do it, all right? So if that wasn't enough, it can also damage the ligaments that hold your spine together. Remember, instability is the #1 cause of chronic pain and disability. So the real problem is that most medical doctors and ER doctors completely miss this. Now, this is not to degrade an ER doctor, because they are looking for life-threatening injuries when you go into an ER. Fractures, dislocations. If they don't see a broken bone or something life-threatening, they assume you're fine. Now, that couldn't be further the truth. Now remember, they want to deal with a life-threatening injury. Are you going to live or are you going to die? However, they're not looking at, are you going to have chronic pain the rest of your life that prevents you from working full-time? So instead of working 40 or 50 hours, you only can work 10 or 15. They're not looking for why you have chronic headaches. They're not looking for the fact that you can't lift your kids, you cannot dance, you can't go golfing, you can't hunt, you cannot train in the gym, you cannot paint with your arms overhead. They're not looking at that you're on chronic medication that's eating away at your stomach, your liver, and your kidneys. They're just looking at, do you have a problem where you're going to die immediately? And that's important. However, we also need to look at what's going to lead to chronic pain and chronic disability. And that's where I come in. That's where I specialize in. So one of the things we look at is there a kyphosis? A kyphosis is a serious injury with long-term consequences if it's not fixed. It's that simple. In this video, I'm going to break down how to assess cervical kyphosis. It's very simple. How to fix it without surgery, and how to find the right doctor that knows how to correct this condition. So you don't want to be stuck with pain, disability, and degeneration for the rest of your life. Keep watching. Now, how do you diagnose? Well, in a minute, we're going to talk about this. Bottom line, you need to have an x-ray while you stand up. And ideally, you should have a doctor that specializes in structural rehab. Now, how do you know? Chiropractic BioPhysics has the certification and a worldwide program to teach doctors how to measure for spinal alignment and how to correct it naturally. And you can always go to CBP online or idealspine.com, and you can find for a directory, find a doctor in your area that can help guide you. Now, when they take an x-ray, we're measuring against a normal research-based value. Just like you got a normal value for your body weight, you got normal for blood pressure, and we're not talking if you're a little off. Just like anything, there's a range. So if you're far from the range, that's what a kyphosis is. It's not a little off, it's way off, okay? And so what happens is this curve shuts down spinal function. And bottom line, again, some of the symptoms of kyphosis, I repeat this, we're talking neck pain, stiffness, headaches, tension in your neck and shoulders, also fatigue. Remember, whenever the muscles have to work harder, guess what? It drains your energy. You're inefficient. We want to move in a very efficient manner. And so also the stiffness in your head. We're talking about nerves that can have pressure not only in your hands, but sometimes you even feel it in the feet if it's affecting the cord. Now, the longer you have it, the longer it stays unfixed. It's that simple. The longer you have it, the worse it gets. The longer you have it, the harder it is to fix. So again, you want to get after it fast. Now, why do traditional treatments fail? And again, I have many patients that come to me and says, Doc, why didn't someone tell me about this earlier? You know, I've been to 3 chiropractors, 5 physical therapists, 4 physiatrists. I've been to a neurologist and a surgeon. And none of them have taken the time to explain it in the 2 minutes that you explained it to me. And there's a reason. So again, if you don't understand that alignment matters, that the shape and position of your spine under a gravity-based environment has an effect on you feel and effect on how you function, well, you're going to be in trouble. So you need to find someone that understands what a normal value for a spine is. There is a range, right? Now, let's talk about physical therapy a little bit. Physical therapy is great. The problem is traditional therapy, we're talking about range of motion, functional changes, which is important, right? We do some physical therapy in this office. However, if you are just doing strengthening, stretching, range of motion, you're missing a piece. You cannot take care of a structural problem just with stretching and strengthening. It's like putting a big engine in a bent frame. And a classic example, and I'll talk about this, is that there are certain positions in the spine that you may look at someone's posture and give them an exercise, but when you see when you take an x-ray, that actual exercise makes it worse. So you have to be able to take an x-ray to measure this, all right? And we're talking about people that have only done what we call functional rehab. That's basically strength, range of motion, all right? And there's a place for it, but it's not going to change the kyphosis. If we don't change the kyphosis or improve it, right, we're not affecting the loading on the joints. And that's the root cause. So we have abnormal alignment, abnormal shape, abnormal position affects the loading on the joints. So if you want long-term relief under gravity, you got to change the loading. So you need more than just typical functional physical therapy, which is strength and range of motion. You also need more than a standard adjustment. So yes, chiropractic adjustments are powerful. They move the bone, they unlock where bones are stuck, they take pressure off the nerve, but the adjustment is not enough to change a kyphosis, if you have a kyphosis. So adjustments are a piece of the solution. Physical therapy is a piece, but what you really need is targeted corrective things. So again, you're looking at painkillers, doesn't address the root cause. I don't need to talk about that. Anti-inflammatories, muscle relaxers, sure they have a place in the early onset of a whiplash, but after that they do not fix a structural problem. You know that. I mean, what drug fixes a structural problem? None. Now they help you feel temporarily better for a while, but I guess we gotta address the root cause, which is the kyphosis. Same thing with cortisone injections. Those are just temporarily masking the pain. They have a place, okay? Now, most of my patients, and you ask yourself, you guys out there, would you want to have more drugs in a medicine cabinet or no drugs? Most people want to get better with the least amount of drugs or none and without surgery. So again, we got to fix the kyphosis, otherwise it leads to chronic pain, stiffness, sometimes permanent nerve compression that leads to weakness and numbness. It certainly leads to spinal degeneration. It certainly leads to increased risks of future injuries. Let's talk about that. Do you want to do contact sports if you have a kyphosis? No. No, it's a contraindication to do contact sports. You want a neck that can absorb shock. What if you have a kyphosis and you get in another car accident? Did you know that a kyphosis leads to a worse outcome for the next accident? You want a spine that can absorb shock, that's pain-free, that's strong, and can handle trauma with the best. In other words, we want a spine that can absorb shock. So what we're going to talk about next is how we fix it. And how do we naturally restore the natural curves of your neck? And that's what corrective chiropractic care is. Corrective chiropractic care starts with the simple concept that there's a normal spinal model. Now, granted, there are ranges. So it's just like blood pressure, just like blood glucose. However, chiropractic biophysics does just that. In the next section, I'm going to show you how CBP is different from anything else you've tried, how it can actually correct a kyphosis without surgery. A proven non-surgical solution to restore or correct cervical kyphosis. That's chiropractic biophysics. It's not easy, but if you have an experienced and trained doctor and a patient that follows the program, it can be done. And I'm going to show you some pictures, and I've shown you in the past some pictures of what's necessary to correct a kyphosis permanently. All right. So what we got to do is we have to focus on applying targeted forces over a period of time. So traditional chiropractic care is typically adjustment only, and it has adjustment only as tremendous benefits. But however, making a structural change, that means a change that changes the alignment as measured by an x-ray, requires more than an adjustment, okay? Now that's just not my experience, that it requires time under tension. So my experience over the last, let's say 30 or so years, a couple 100,000 visits, I wish it was as simple as just making an adjustment on the spine, but it takes more. It takes pressure over time. It takes targeted. That means very specific, a mirror image exercise, a mirror image adjustment, and traction to retrain the spine into a proper position. Now, chiropractic biophysics, or CBP, is supported by over 360 published research studies and is one of the only chiropractic methods to restore cervical lordosis without surgery. I want to let that sink in. It is one of the only one to correct a kyphosis without surgery. So what are the three key components? Well, we use an acronym called EAT, exercise, adjustments, and traction. And we're saying the mirror image. That's the opposite of your alignment. So there are specific exercises that we will do to help you restore alignment. And then we're going to do specific adjustments of the spine, not a general manipulation. Many times people watch a variety of physicians on YouTube and they see some kind of general manipulation, pops and cracks. And the bottom line is whatever noise your spine makes is almost irrelevant in terms of how it functions. So I don't worry about pops and cracks. We're talking about alignment. If you want a long-term health benefit, that means less pain, better strength, better mobility, better nervous system function, alignment matters. And then the most critical step after the exercise, after the adjustment, is the mirror image traction. That's the most critical step. We're using specialized traction setups. These are forces to gently stretch the spine in the opposite direction of the kyphosis. We want to promote a long-term change. So a couple types of traction. We use a dinero roll for home. That's a research-backed orthotic design to restore proper neck curve by gently molding the spine over time. And then we're going to do something called a neck exerciser. These are banded resisted exercise tools at the apex of the curve to strengthen the deep spinal stabilizers, again, to support the restored curve. And it's not just about pain relief. That's the first goal. So many times we have to use a variety of methods to get you out of pain. That would be traditional and targeted chiropractic adjustments, perhaps ice, perhaps spinal decompression. So we got to get you out of pain so that we can fix you to restore the curve. Now, corrective care is by changing structure for a long-term health benefit. In the next section, I'm going to talk a little bit about time and what's necessary to correct a curve. So we'll talk about how long it takes and the frequency. Right now, let's demonstrate some of the methods we use. So let's talk about reversing a kyphosis. Again, here is a study that talks about how car crashes can cause a kyphosis and pain. So what do we want to do is we want to reverse that. So here's an example of a patient of mine. And as you can see, the blue line is normal. This is far from normal. We measure, this is over 29 millimeters from normal. So where do we begin? Once a patient is comfortable, again, nothing should hurt you, everything should be comfortable for you. We would start by doing a warm-up to kyphosis correction. So these joints right here, so this is number 7. So right about the apex here, we would put this Theracane, and we're going to put it in the back of the spine, all right? And we're going to gently work on range of motion in all directions. And we're going to try to break up some of the scar tissue, and we're going to push right around this area. We're going to be just to the right and also just to the left of the spine, okay? Now talk to your doctor. Hopefully you have a corrective chiropractor, a biomechanical expert that can guide you where to put this. Up and down, side to side, side bending, and I would do this right at the stiffest area, okay? And again, your chiropractor will guide you. After we do that, then we're going to use, this is called a neck exerciser. We're going to target right here. So what are we going to do? We're going to put this behind the neck. In this individual, we're going to have our arms slightly above horizontal. Now, some people, our arms are down low, some people horizontal, some people above. So again, we're talking about very targeted exercise. And so we put tension and bring our head back. Now, some people need arms up like this, some people need arms down. Again, this is a doctor prescribed, but this is a direction. Now, it should feel good to you. Nothing should cause pain. So we would do this. We would hold each repetition for about 10 seconds, And I recommend about 5 minutes on and off. So we use the Theracane to kind of break up some scar tissue, get loosened up. We use the neck exerciser specifically to apply a force. And then we're going to lie on our back with it on the dinner roll. Now this is what we do at home, but we will also show you what we do in the office. So what does that look like? This is the pre, remember the number 29. And that's the post, we're at 17. Okay? So we're going in the right direction, we're reducing it. This is another example. Blue line is normal. The pre, we're talking about 17, 18 millimeters. The post, we restored the curve there. The pre, blue line is normal, yellow is this individual. The post. So we're getting closer to normal. This is a motion x-ray. This tells us where there's ligament damage and where there's normal motion or where there's limited motion. This would be a stuck area that we would target with adjustments, exercise, and traction. So again, there should be focus on specificity and diagnosis, not just general manipulation. This is an example of a traction, and if you go through my website, and you will see this person's testimonial talk about many years of horrible migraines that we improved and corrected because we're the only one that changed alignment. This is what a traction setup. This is a full spine traction setup for neck and lower back. This is what traction looks like for kyphosis. This is called a two-way traction. This is another example of two-way traction. Notice the forward pull is at 90 degrees. Again, some people it should be down, some people it should be above. And how far back the head goes back depends on your tolerance. Some people cannot tolerate it. Other people can handle it. So everybody is different. Now, many people ask me, how long does it take? And the answer always, it depends. How much pain are you in? How much pressure on the nerves? Do you have pain going down your arms? What's your tolerance for bringing your head back? How much scar tissue? How much arthritis? But I can say that the majority of people, we can see great improvement in 3 to 6 months. All right, some people be closer to 3 months, and some people might even be closer to 9 months or maybe a year. Everybody's different. So typically we work aggressively in 3-month blocks. Typically we work 2 to 3 times a week. Typically we take an x-ray at the end of 3 months. Usually we do an examination every 30 days where we touch base on, are you comfortable with the adjustments, exercise, and traction? Are you doing things at home that are helping or hurting you? Are you doing your home care? Are you doing your ergonomics? In other words, are you avoid having your head down all day long? All those things play a role, and we have that conversation usually once a month. So think about it 2 to 3 times a week. We do a 3-month block, we take an x-ray at the end of 3 months, and then we go from there. So our goal is to get you as best as you can be in as little time as possible. The key is consistency. So if you can help me by helping yourself doing home care at home, you can save yourself time and money. That's why you need to act now. Because if you ignore a kyphosis, it just doesn't get any better. And obviously it's going to increase your risk for chronic pain. Chronic pain that becomes harder and harder to treat. Nerve compression causing permanent weakness or numbness. Spinal degeneration that leads to arthritis and disc damage, and increased risk of more severe spinal injuries in the future. In other words, if you have a kyphosis, everything goes bad. So if you were in a contact sport, if you were in a kyphosis, you're at a very high risk for a catastrophic injury. If you have a kyphosis when you get in a car accident, it's going to take less force for the same amount or more injury. So that's why time is of the essence. Spinal problems are degenerative in nature, no different than a misaligned tire. The difference is if a tire is misaligned, it's easier to replace. So once your spine is damaged, it's very hard or impossible to replace. So I recommend using natural, non-surgical corrective care procedures like chiropractic biophysics, adjustments, exercise, and traction. Not all chiropractors are trained in chiropractic biophysics. You need to find someone who specializes in corrective spinal care. To find a CBP certified doctor near you, very simply visit www.idealspine.com. That's www.idealspine.com and use their provider search tool. Or if you're not sure where to start, just drop a comment below and I'll send you a link directly. Listen, if you've been struggling for pain and no one has given you a real answer, there's hope. If you've been to countless chiropractors, you've had 1 million adjustments, you've been to 7 different physical therapists, you've been to pain managements where they've given you pills, potions, injections, they might have even tried to burn or kill the nerves, and you're still suffering, well, there's hope. And the reason that most people have chronic pain, in my experience over the last 30 years, is number one, they never had a specific targeted diagnosis. They didn't take the proper x-rays. They didn't do motion studies to see where the ligaments were damaged. And then once they have a proper biomechanical or engineering diagnosis, there wasn't a corrective program. They're just treating the symptoms, whether they're treating the symptoms with general manipulation, treating the symptoms with general exercise and physical therapy, or doing shots, or doing surgery. You have to address the root cause to get a long-term solution. So if you don't want to live with pain forever, and you've been struggling for pain, and no one has given you any real answers, there's hope. Bottom line is, the key is taking action now before it's too late. You got a question? Leave a comment below, and I'll do my best to help. Do me a favor, like and share so more people can find the right information about spinal health and specifically cervical kyphosis. If you found these tips helpful, you know what to do. Like the video, subscribe for more safety advice, and share it with others who could benefit. The video that you need to watch is 5 steps targeted recovery plan for whiplash. This is where I'm going to break down the exact steps to recover faster and prevent long-term damage. Go watch this video next.